I'm going to discuss the topic of conflict resolution. This PowerPoint was prepared by Stacy, Jelaine, and Florence as part of the requirements for integration of the profession in nursing for the RN. So the topic we chose is conflict resolution. And what we've learned in our research is that conflict is an inevitable part of life, and anytime we have individuals gathered together from different backgrounds, they're going to bring forth different ideas. And any form of communication about those ideas may bring forth conflict. So we're going to see conflict in the home, at work, in the schools, and in the community. So it's our responsibility as nurses to be aware that conflict does occur and that we have a role in being sure that we resolve that conflict effectively and respectfully. So the definition of conflict is when two or more values, perspectives, and opinions are contradictory in nature and have not been allied or agreed upon. So when we look at conflict resolution, it's a way for two or more parties to find a peaceful solution to a disagreement among them. And when properly addressed with respect and good communication, resolution of this conflict can occur. And not all conflict is bad. It provides an opportunity to explore ideas and to develop a more comprehensive approach to a problem or situation. When we look at the history of conflict resolution, in the early 20th century, conflict was considered to be an indication of poor organizational management. It was deemed destructive and avoided at all costs. It was typically ignored and denied. It's the early European cultural norms that supported the unconditional respect for elders and those in authority that led to this perception of conflict. But in the mid-20th century, as we became more industrialized and diverse as a nation, worker satisfaction and feedback became more important and were perceived as normal and expected. So we saw the attention centered on teaching the manager how to resolve conflict rather than how to avoid it. So when we look at the different types of conflict that can exist in between individuals or among individuals, we've identified three major types. Interpersonal conflict occurs within an individual. So when an employee frequently calls in sick because she's the only person who can care for a sick or family member, that can cause a lot of stress due to the conflicting roles of that individual employee. Intragroup conflict occurs within a specific group. For example, nurses gossiping about other nurses within the group of nursing is an example of intragroup conflict. And then intergroup conflict occurs when there is incompatibility of goals, beliefs, attitudes, or behaviors between groups. For example, emergency room nurses might feel that the lab is not working with them in providing lab results in a timely manner. And when we look in the hospital environment, there's a number of different groups that work collaboratively as part of the healthcare team. So intergroup conflict is something that can definitely occur if we don't have well-defined roles within our hospital or healthcare environment. And if we look at these different types of conflict, we may encounter all three of these types at one time or another in our lives, either at home, work, or in our communities. So conflict in nursing requires that our nurse managers or leaders develop a management style that can minimize resistance and provide support satisfactory to resolve any group or individual conflict. So when we look at conflicts regarding change and compliance, we have to resolve those quickly to avoid any disruption of progress. For example, when we look at nursing specifically, evidence-based practice guidelines require that we incorporate strategies to resolve conflict quickly because we don't want any conflict to affect the quality of care that we provide to patients. And when we use prepared techniques as managers and staff, that will support corrective action as soon as conflict occurs, because if we leave resolution to a later date, sometimes that will intensify the issue. For example, if we develop a bad practice as nurses and then as preceptors we pass those bad practices on to our new nurses, that's going to solidify those old habits. As we've heard the term, old habits are hard to break. So when you look at, again, sources of conflict in nursing, we see this conflict again as interpersonal, and among different groups. So some examples of this, nurses and other nurses, we often have different styles of nursing and how we approach our care. Some nurses are more task-oriented, so they're less likely to socialize with their patients beyond what's typically, required. They may not socialize with other nurses. They're very focused on tasks. Where other nurses might be more focused on, relationships, and they spend a little bit more time socializing in the patient rooms, and that might be perceived as not adhering to the tasks assigned to the nurse, and that different style of nursing can result in conflict. Nurses and other healthcare professionals, doctors provide orders and nurses are responsible for carrying out those orders, but sometimes those orders may conflict with the desires of the patient or the family, and the nurse has to serve as an advocate. So that can be a source of conflict between the doctor and the nurse as they try to resolve the patient needs and what the doctor feels is necessary to care for the patient effectively. And nurses, patients, and their family members, sometimes the family wants care that isn't appropriate for their family member. For example, an elderly patient who maybe became ill at home and is having a hard time caring for herself, the family may feel that nursing home placement is appropriate. However, the healthcare team may decide that going home with some physical therapy prior to discharge would be appropriate and is what the patient desires. So conflict can occur between all of these groups within a healthcare setting. So when you look at what the goals of conflict resolution is, first of all, confronting the problem, communicating openly and respectfully with someone is important. So when we communicate about areas of conflict, we want to make sure that we are choosing the correct time, place, and that the mood of that communication is appropriate and stress levels aren't high where individuals might have a hard time listening to one another because of their mood at the time. So when you look at the process for resolving conflict, the first thing we need to do is assign a level of importance to the conflict. We need to ask ourselves, is this conflict life-threatening? Is it a patient safety issue where a compromise might actually be dangerous? And then we have to consider the level of intensity in terms of the consequences, and then decide, well, will we need a mediator? In some cases, if a conflict has been addressed between two individuals and the issue was not able to be resolved between those two individuals, then it might be important to involve the nurse manager or even another nurse to help problem solve the situation. And this might be important, for example, if someone observes a staff member not using the patient movement equipment for safety. For example, if a patient requires a ceiling lift and a nurse or a nurse's aide is not using that and is trying to move the patient by herself and putting herself at risk and the patient at risk for a fall. So styles of conflict resolution we might see being applied to a situation. There are 5. One is avoiding the situation. This might be when something will work itself out over time. It's a minor conflict that doesn't really require intervention from the management. For example, if a nurse is busy and she snaps at a CNA or another nurse when they're busy and does not use respectful communication, it might be best to just avoid that and allow the situation to pass, assuming that it's not a chronic problem. Accommodating is when we use something, a style of conflict resolution to smooth things over, and that might provide a temporary solution to an issue that can be dealt with at a later date or when other factors might be involved in resolving the conflict. Competing is when the style dominates the situation and provides a solution because it demands immediate attention. Competing has the risk of damaging the relationship or even a long-standing relationship. When someone has to just make a decision and that decision stands, others may feel put upon by that decision. And for example, if a charge nurse has to reassign a patient to a different RN because the family felt there was a personality conflict, the RN that lost that patient might feel that the charge nurse was treating her unfairly or not advocating for her. But it is necessary to make that decision to make sure the patient gets the quality care and that the family's wishes are respected. Compromising is when we see satisfaction or an effort to bring satisfaction to all parties involved. And this might be useful when the ideas are widely divergent, so the needs or the preferences of the individuals are very much in conflict. And as a result, the parts of the solution might be unacceptable to each party, but they come to a middle ground where that's the only acceptable choice. We can't fully meet the needs of both parties, so we come to some middle ground. Collaborating is the ideal scenario when you have a group of people working together through differences and to solve problems so everyone benefits. A good example would be this is when we have a group that has been assigned to reduce falls on a unit, and you have a group of nurses' aides, nurses, physical therapists, and the nurse manager finding ways that are efficient in process yet have quality patient outcomes and act to reduce falls. So if we apply a specific scenario to nursing practice with conflict resolution, if we look at a scenario, for example, if a nurse disagrees with how a pediatric patient's parents are handling their child's medical situation, for example, let's say we have a 12-year-old child with cystic fibrosis, which requires a lot of at-home management with nighttime tube feedings and chest physiotherapy and medication management. And if a family is not properly caring for their child and providing those at-home management strategies, that would result in multiple hospitalizations, multiple lung infections, and that might be difficult for the nurse to handle that patient's situation, and she has a responsibility to address the neglect of care that's being provided by the parents. So one way to approach this conflict would be for the nurse to avoid the situation and to just perform the tasks for that child during the current hospitalization and not address the issue or communicate to others about the issue. Obviously, that is not an ideal scenario because that's going to affect the quality of this patient's life and long-term outcomes. Number two, accommodating would be if the nurse provides the extra care and nurturing to the child during the hospitalization, but then she does report the conflict to social services or the primary care provider, indicating that there's poor management practices at home for this child's cystic fibrosis. Competing would be if the nurse confronts the parents about the conflict and informs them of the harm to the child caused by the parents' approach to care. So this would be where she educates the parents on the importance of chest physical therapy and nighttime tube feedings for making sure the child has the highest quality of life as possible. Compromising would be where the nurse and the parents come to a mutually agreed upon approach, but it may not completely satisfy all the parties involved. For example, if the parents have a holistic approach to care, they might not like the idea of a nighttime tube feeding. They may prefer to just give highly nutritious food by mouth and not provide the tube feedings. Or they may not have the ability to perform the chest physical therapy at home. So the nurse could suggest that the parents could provide the healthy foods but agree to perform more chest physiotherapy during the day, and the parents might agree that they would increase the chest physiotherapy but not agree to the nighttime tube feedings, and the nurse and the parents could agree that that would be a new approach. And the child would benefit from the improved care on the side of the parents, but it wouldn't be ideal because of the nighttime tube feedings not occurring and that child not getting enough calories. Collaborating would be when the nurse, the parents, and the healthcare team work together to decide on a method of care that will be satisfactory to all involved. So this would be where maybe we could involve a community health nurse that would come in and check on the family on a regular basis, assisting them with nighttime tube feedings, reinforcing the importance of the nighttime tube feedings, providing medications, and the chest physical therapy. So suggestions for nursing practice is it's very important that when we look at conflict resolution that we engage in respectful dialogue. And that is using respectful verbiage. For example, using I statements, I feel, I think, and avoiding confronting individuals by saying you are doing this or you are doing that. So it's important that we have dialogue and communication as a first step, and that we involve those in the conflict in that dialogue, and avoid gossiping or talking to management prior to talking to the colleague that we're having the conflict with. Because we know that a lack of communication is an example of avoidance, and it is not an effective strategy. So we cannot actually resolve the conflict if we don't talk about it. Coaching is another way that we can improve conflict resolution in the nursing environment. So the nurse manager can educate nurses how to effectively resolve conflict on their own. So if a nurse comes to the manager with a conflict, she can give her quality feedback on how to resolve that with the nurse without the manager's involvement, if possible. So other examples would be having practicing strategies, for example, on case scenarios, role-playing exercises for disputes or disagreements, and having those at monthly team meetings. So all members of the team can be involved and practice those strategies before they occur in a real-life scenario. And it would be very important as well as the manager to serve as a role model for conflict resolution and avoid taking sides in a situation where the conflict may not have a clear answer. Providing good education and training is essential, not only for staff but also nurse leaders and managers. And I think evaluation of that education and of the performance of our managers and staff is important, so we can see if there's any deficits in the educational process, and those strategies can be improved, because we know that learning conflict management strategies empowers nurses to resolve conflict early and influence the work environment in which they deliver patient care. So it's important that we look at conflict among all staff and leaders within the hospital to ensure quality outcomes for individuals that work in the healthcare environment, as well as patients and family that are affected by their care.